Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Welcome back to Creative Caregiving and Beyond. And today we have a great guest. I'm so excited to bring on Josephine Rhone with OPCO Management. Josie, welcome.
Thank you.
It's so good to have you here.
I am excited. Thank you so much.
Now, Josie, you work as a skilled in skilled management in the admissions area.
Yes,
Okay.
I'm a clinical liaison.
Okay, very good. Now, what exactly is that in your role in that area?
So what that is basically my role is to help bridge my skilled nursing facilities and the hospital. I'm that person, the go-between. And so I'm assisting families and doctors and the case managements or the discharge planners find either short-term skilled therapy placement or long-term placement.
Okay, very good. Well, I'm sure that's a great help for the families because that's
yes.
a pretty trying time. Usually your families are in the hospital when you start talking to them?
At times they're in the hospital,
Okay.
but as you know, some families and the way the world runs now, that they're still working, so sometimes these conversations may start at bedside with their loved one, and
Okay.
if they're able to move forward, then we move forward with that individual, but sometimes then I do reach out to families, and that process is done with them, whether it's over the phone initially and then we meet up, but yes, yeah, it is definitely started at that hospital level, and then we also do admit from home as well.
Okay, great. Well, how did you get started in the elder care sector? What drew you to this area?
Well, I have been in this working with seniors for a very long time, since 1995.
No way.
Yes. I started off as a CNA,
Okay.
and I just always have loved working with seniors. My mom worked with seniors, so she actually got 4 out of 5 of us into that.
Wow.
Yeah, starting off, and my sister and I both remain. My sister's a nurse as well. And so I've just always loved working with seniors, and so I became a CNA. Then I became an LVN, and just been doing it. And I love the senior population.
Awesome.
Yeah.
So it runs in the family.
It does. Yes. Yes. It
Runs in
does.
the family. Well, great. And I'm sure it helps having that nursing background when you're communicating to families.
It does. I feel like in this role that I have now, me being a nurse and working in long-term care definitely gives me the advantage to have an open and honest and very transparent conversation with the families, because I know what's happening on the end of the hospital, of course, and how that transition, but then I can also give them an idea and allow them to have an open expectation of what's going to happen once they enter into our facilities as well, and what to expect, because I am a nurse and I actually still do work the floor as well. Yeah.
Oh, very
currently,
good.
so yeah.
So once they see you, they'll see you again. They'll
It's
say,
a
"Well, there's
possibility,
Josie."
depending on depending on where they go. Yes,
Yes.
absolutely, yes.
Awesome. Well, from a personal experience, I've been there with my mom, and it can be very daunting. Even though I'm an elder law attorney, I don't really necessarily comprehend that part of the medical side, and there's so many moving parts, and then that transition part for skilled nursing, because they're concerned about their loved one, and they want to make sure or see if they can get back up to where they were, if that's a possibility.
Yes.
And so that's a conversation that someone like you with that medical background, that nursing background, can help with.
It's so overwhelming at that level, because like you said, those individuals are dealing with their loved ones having these medical issues, and then you also now have to start thinking about and transitioning into the financial part of it too.
Yes.
What does that mean? As far as insurance, or if we're looking at long-term care Medicaid, and of course, again, their loved one is still having these medical issues, so it's just a lot. So yes, they're long conversations and a lot of teaching, a lot of educating, a lot of, you know, I understand what you're going through, and we're gonna make it. We're gonna get you through this. And yes, a lot of hand holding, and that's part of the part that I really enjoy about it, because at the end, the families, they're so overwhelmed that once we get involved and start helping them, you can hear the relief and see it as well. Yeah.
And they need that encouragement. They need to know from someone that it's going to be okay, not just this is what it is and that's just what it's going to be.
And sometimes, yes, unfortunately, that is sometimes what they're hearing too. So it's my job and my responsibility to help teach them and give them what they need and the resources that they need in order to make that transition. Yeah.
That's awesome. So your company is allows that support for the families.
Oh, absolutely. It's one of the main things that we're proud of to be, is that resource for the families. And even the partners that we have, the hospitals and things like that, we want to be that resource. We want to be able to help you get to that level of long-term care or skilled nursing that you're wanting. And so we're going to do whatever it takes to make sure that happens to the best of our ability.
Great.
And that's why I really love what I do, and that's why I love the company that I work for, because that's what our goal is.
That makes a difference, that personal touch.
It does.
And making sure people are just not herded through.
Right.
And without consideration, because it is a truly emotional time.
It is.
Yeah.
It is.
Yeah.
I can say there's many times where has been lots of tears and frustration and guilt and so
Right.
We're here, and my job is to be able to, let you know that I can help you. Yeah.
Well, how do you handle that? You've got a family. They've decided to come into your facility, and they are dealing with that. They're dealing with guilt. They're dealing with, have I made the right decision? What are some of the things that you guys consider in just shoring up their decision that this is the place where they can actually, their loved one can get better?
Well, it's
hopefully get better.
Right.
Yes.
It's more so giving them the comfort of knowing, just like you say, this is the right decision. It's hard to take care of someone especially when it gets time to make that transition into long-term care. It's really hard to take care of someone at home.
Yes.
Day in and day out. It can be very taxing, but then at the same time, there are loved ones that have that guilt of, well, I said I wasn't going to, or, I promised, or I feel like this may be my responsibility. And, at that point, sometimes it's more of a conversation that right now, as taxing and as tiring as it may be, you would be better for them to allow us to take care of that part. And now you can still love on them, and you can come see them, and now you can be back to being the daughter or the husband, or as opposed to the caretaker. Let us do that part, and then you can be back to that relationship of which you had before. Yes. And then knowing that, your loved one is going to be taken care of, you can come and see them, but we'll do that hands-on part.
That is so true, because that's time. And that time is really precious at that point.
It is.
And not to have to maneuver all of the moving parts and other things that someone else, the facility can take care of for them.
Yes.
And they can enjoy that time with their loved one.
Yes.
Yeah.
Yeah.
Can you think of any stories or particular families that you guys have impacted, or you remember that really stuck out in your mind and said, boy, I'll never forget that situation? or that family being we really dug in and we were really able to help them?
I feel like there's so many. It's so hard to say what they are. I can honestly say that I can probably remember bits and pieces of several family members, just like I said, just being so grateful, so thankful. And that's what makes me continue to do what I do, and so blessed to do what I do, because having to help people when they're in the most stressful time of their lives, when their loved ones they don't know what's going to happen to them health-wise. They maybe, especially depending on what's happening at the hospital level, it's scary. And then to have someone come in and help you navigate, how to move forward, the relief that these families have. That's what anytime I think of a story, it's more so not how we got through, but what the end was.
The end result.
Yes,
That's true, and that's how you measure it too. Was it a positive result?
And that's what it is. I hear a lot of, thank you so much. I really appreciate, I didn't know how we get through it. And, the unfortunate thing about it is that there's other people that came before me, but unfortunately, they just did not give that same time and care and ear that person needed.
Yes. Yeah. Well, that's awesome. You do a great work.
Thank you.
Now, did you guys provide an assessment when they're at the hospital level? How do you determine if they're a good candidate to come into your facility?
Yes. Well, we always want to make sure that we can take care of anyone that comes into any of our buildings clinically.
Okay.
So yes, there is going to be a nurse that's going to clinically approve and accept that person.
Okay.
And then there will be what we call a financial approval. So that will be whether or not they'll be coming in on their insurance, or if they have Medicaid, or whether they'll be coming in private pay. So that's really how that works. So yes, we do a clinical assessment, and then at times there will be also a bedside assessment as well.
Okay.
Yes.
So the wheels are turning pretty fast during this time frame.
Absolutely, yes.
So how long does it normally take from the time you do the meet with the family, make the assessment, that they know that they can become accepted to that facility and transition from the hospital to
Everyone is different.
Yeah.
Yes. Everyone is different, and I'll give you some examples as to why sometimes someone may not clinically right now be ready.
Okay.
Because they could be still in the ICU, or they could be still have just not quite stable enough. So once this person becomes stable, then we can reevaluate and then clinically accept. Now, if there's someone that is just ready to go, that process can happen, I would say, within 30 minutes to an hour.
Okay.
Yes.
Okay.
Yeah, very quickly. And we try to make at least the clinical acceptance quickly, because once you then start involving the insurance, that can take a little bit longer.
That's true. And
yeah,
it's out of your control at that point.
Exactly, yes. So the most important thing that we try to have for our partners is a quick acceptance on the clinical.
Okay. So what would you recommend to a family? What type of information do they need to have available if their loved one has just been transported to the hospital? What makes it, so they're not digging through paperwork? I mean, what should they already have in a folder or something that would make that easier for you guys and for them in the long run?
That is an excellent question. I would say that if they're having a loved one that may be starting to have frequent hospitalizations, to have a folder or binder that would have a list of all their current medications.
Okay.
A list of the names and at least numbers of the physicians that they see, especially if they see cardiologists, specialists, and things like that. That would be also important. If there's a power of attorney or a DNR, that's something that's also important to have, because once you admit it into the hospital, if your loved one may need short-term rehab or long-term care, at that level too, once you will need that information as well. So those are I would say would be some of the most important paperwork. Of course, if they could get a copy of their insurance card, their Medicare card, if they have a managed care card as well, those are important. Yes.
Awesome. Well, that's going to be a great little checklist.
Yes.
I'm sure our viewers are going to love that, because that's going to be great. And we need to know that, because it's hard finding things when you're in an emergency situation.
It is. It is. Yes.
I can barely find my keys when I'm trying to, I'm trying to leave fast. I'm like, where are my keys? Where's my phone?
Yes, absolutely.
And so,
Yeah, and especially if it's you're in a panic as well.
Exactly.
It's easy to just grab that folder, grab that binder, and just go. Yeah.
Very good. Very good. Well, and how large is your facility?
I have 7 buildings in Fort Worth, and they range from different sizes. So yes, we have some that are a little under 100. We have some that are over 200. So it just really depends. Yeah.
And are any of them unique in a certain way that would attract a certain type of person?
Well, I would say that all of our facilities can manage vast clinical capabilities. However, we do have one of my buildings has just an all-male. secure unit. I
Really?
have one, yes,
Okay.
that is an all-female secure unit.
Okay.
We do also have co-ed units as well for and some of our buildings also can take a little bit extra as far as the type of clinical capabilities that may come in. They can take a little, maybe something that's a little bit more complex.
Okay.
So it really just depends, and that is also a part of my job. Once I get that clinical and I read it, I'm able to direct it to whichever building I feel would be the best to serve that individual and the families.
Oh, that's wonderful.
Yes.
So they'll have a selection.
Yes.
And would you recommend the family tour the facility?
Yes, yes. I would always recommend our families to tour the facilities, meet my mission coordinator. That would be the person that I work with on the inside,
Okay.
and so that they have a feel of where they're going, so that they know where their loved one is. I always think that that's important, to go into the building, see how that feels, talk to the staff. Yeah.
Yes.
And I would suggest that to anyone that's going into long-term care, wherever your loved one goes. That would be the best thing to do, because you may walk into a building that's nice and pretty and beautiful, but you may feel the coldness from the staff. So and you want to be able to place your loved one where you feel that they're going to be comfortable, where they're going to be comfortable and you're going to be comfortable. And having that tour and looking at that facility is one of the best ways to do that.
Great,
Yeah.
great. Well, I would imagine it sounds pretty rare that the facilities that are the units that have all male and all female. That's a unique.
It is unique, and
Yeah.
we're glad to be able to have that. So yeah.
Yeah. Do you get that request often from families?
We do. There are times,
sometimes.
yes, that is needed and necessary, and that's why I'm so glad that our company is able to provide that to the community.
Yeah. That's a great idea. That's wonderful. So what advice would you offer families when they're going through this process as to navigating the whole picture? In hindsight, if they've finished it, they've gone through it. What advice would you give a family that maybe even just lost a loved one, and they're segueing out of your facility? Do you guys have like chaplains there? Do you have any type of emotional support? Because I know that can be hard if they're getting a phone call to come up there,
Yes.
and there's a traumatic situation.
Yes, we do. Yes, all of our facilities do have chaplains, and they also do have social workers that yes, can help and speak with the family to during that transition, especially after you've lost someone. And too, when we have our residents that have been there for a long time, it's also, the staff also gets close, and it's sad. It's sad for them as well, and the residents too. So yeah, we do have staff that's able to be there to speak with the families and the residents during those times when it's a little bit harder when we've lost someone.
Okay.
Yeah.
Very good. Very good. So what is the typical day for a resident, would you say? I know it can vary, depends on who's getting therapy and things like that, but typically, what would they face during the day?
One of the things that we have to remember is that this is their home. So so we want to make sure that we are providing them with the care and the activities that they want to do, but also be mindful that it is their time as well. So, we're going to have, and some of our residents, they want to get up when they want to get up. Yes, and
that's so true.
We, we'll have breakfast in the morning. There will be an activity of some sort always. Of course, those who will participate in therapy will have that as well. Then there'll be lunch, and then those who request or need to lie down will then lay down at that time. And of course, the nurses are coming through, passing their medications, doing their treatments and things like that. There'll be activities again in the afternoon hour. The activities can vary from music to some sort of arts. Sometimes they do cooking classes. And of course, the great bingo.
Bingo, yes.
Got to have bingo.
I bet that's pretty competitive.
Oh, yes, and must have it too, yes. Don't skip bingo. Yes. So yeah, and of course then it's the dinner meal, and then off to sleep for the ones that are ready. And you'd be surprised though, there's some that are they're night owls too. There's some that are still night owls. So it just really depends on the individual. But throughout the day, we try to provide them with the activities that they'll enjoy, and to just keep them going and get them out of the rooms. interacting with others, and laughing and talking. Yeah,
Great.
Music. They love music, so yeah, just really all of our buildings. They kind of have their own feel to them, but everyone is having a good time.
Good.
Yeah,
That's great.
and that's one of the things too I love with my OPCO buildings is that they all may look different and feel different, but everyone's having a good time. Yeah, yeah.
Well, I love the vision of OPCO.
Thank you.
What you guys are doing for families and helping the community.
Thank you.
That's needed, and we need to see more of that too.
Yes.
Yeah,
Yes. Yeah.
yeah. So if someone wanted to get in contact with you, if they wanted to come and tour, get more information about your different buildings, how would they reach you? How would they reach out to OPCO?
So if they would, depending on which one of my buildings that they would want to see, they can reach me at 817-346-9721.
Okay, great. And that's for Josie.
Yes. Yes.
Well, thank you for coming on.
Thank you.
It's great learning about your buildings at OPCO and
Thank
you,
you.
and
Thank you.
and your career in this and commitment in the elder
yes.
care sector.
Yes, definitely.
Yeah. Thank you so much.
Absolutely. Thank you for having me.
It's been a good show.
Thank you.
And I hope you've enjoyed it too, our audience out there. And don't forget to subscribe and like our videos. And we've got many more to come. So thank you for watching.